Dennis, I'm very sorry to hear about your recent illness, but wanted to take this opportunity to remind you of the great things you've done here since you arrived nearly 20 years ago. My family still remembers that time you joined us for dinner a few days after you'd arrived and regaled us with some very amusing stories, with everyone laughing around the dinner table. When you arrived here 20 years ago from McGill, laparoscopy was limited to removing gallbladders. And there were many doubters that the laparoscopy would ever replace a good incision. In fact, it was a time when it was still believed that great surgeons made great incisions. Well, you showed us. You showed us what could be done with the right skill and equipment. I personally remain very grateful for the generous hours that you provided to me with great patience as I learnt these skills from you. You leave a legacy of a developed program with surgery now done here by many surgeons, laparoscopic surgery that in the past we would never have believed was possible. You also leave a legacy of young, skilled surgeons across the country that have learned from you how to operate and how to handle difficult situations in the operating room, often unexpected. And of course, when you deal with complications in the operating room, it's even more difficult when you're doing laparoscopic surgery and you can't get your hands on the problem. Your wit, your stories, your quiet humor are legendary. So, Dennis, we wish you well as you face these new challenges, which I'm sure that you will handle in the way you always did handle difficult situations in the operating room. So, good luck, Dennis, and thanks for all those good times.